So we'll start by looking at the really fundamental goals of physiotherapy and rehabilitation in the context of MS specifically.
Okay.
And then we're going to explore the range of approaches that are available, and you might be surprised by how many different options there actually are.
Okay.
From there, we'll focus on why stretching and flexibility are so important and often overlooked.
Yeah, I've heard that a lot, actually.
Yeah, it's crucial. And then we'll move on to balance and coordination exercises.
Okay.
Again, a really key area. Then we'll look at the benefits of both aerobic and strengthening exercises.
Okay.
We'll touch on things like respiratory muscle training and telerehabilitation, which is becoming increasingly popular and accessible.
Yeah.
And then finally, we'll tackle those really important practical considerations for managing things like fatigue, heat intolerance, fall risk spasticity, and just general safety during exercise.
That sounds like exactly what I need. Let's jump in.
Yeah.
When we talk about physiotherapy and rehabilitation in the context of MS, what are we really trying to achieve?
So the materials you've shared really emphasize this idea that it's not just about one person
Right.
or one type of treatment.
Yeah.
We're talking about a multidisciplinary approach,
Okay.
which means it often involves a team of healthcare professionals.
Okay.
And I think this is really crucial. It's patient-centered.
Yeah.
So this isn't something that's done to you.
Right.
This is something that requires your active involvement.
Okay, so you're part of the team.
Absolutely.
Yeah.
Yeah, and the main objectives are actually quite broad, but they're all interconnected.
Okay.
We're talking about improving those fundamental motor skills, the everyday movements that MS can sometimes make more challenging.
Right.
So it's about boosting your overall functionality,
Yeah.
making those daily tasks, feel less like a struggle, and building that muscle strength to support everything you do.
Yeah, strength is so fundamental, isn't it?
It is.
You don't realize how much you rely on it until it's not there.
Yeah, absolutely. And it's not just about brute strength.
Right.
Physiotherapy and rehabilitation can really help to sharpen your coordination, improve your balance, which we know can be affected in MS.
Right.
Prevention's also a big piece of the puzzle. So trying to prevent issues like urinary incontinence,
Yeah.
muscle weakness from getting worse.
Okay.
And something that you might find surprising is that it's also focused on maintaining or even increasing the range of motion in your joints.
Okay, interesting. So keeping yourself moving.
Yeah, keeping yourself mobile and flexible in the long run.
So it's more than just the physical symptoms then.
Absolutely.
Yeah.
Your materials point out that a key aim is to prevent those secondary issues
Okay.
that can sometimes arise.
Okay, like
So think about things like fatigue, depression, anxiety.
right.
These can become more prevalent if reduced mobility leads to a more sedentary lifestyle.
Right.
And here's something really fascinating.
Yeah.
Some of the research even suggests that physiotherapy and rehabilitation can have a positive impact on cognitive functions
Wow.
and even boost your motivation levels.
That I did not realize.
Yeah, so it's really a holistic approach that recognizes the interconnectedness of mind and body.
That's a really interesting point. I hadn't really thought about the link to cognitive function and motivation.
Yeah,
Okay, so you might do a few different things.
exactly.
That's really encouraging to know. There are so many different avenues to explore.
Yeah.
Let's go back to those traditional exercises that you mentioned.
Mm-hmm.
What would those typically include for someone with MS?
So the core of traditional physiotherapy and rehabilitation for MS, as outlined in your sources, typically involves aerobic exercise to improve your cardiovascular fitness, strengthening exercises, to build and maintain muscle stretching exercises to improve flexibility and range of motion, balance and stabilization exercises to help prevent falls,
Right.
and breathing exercises also often incorporate.
So pretty much everything.
Yeah, it covers a lot of bases, but the real key here,
Yeah.
and something that your sources emphasize again and again, is this absolute necessity of tailoring these exercises to your individual needs, your personal goals, what you hope to achieve through physiotherapy,
Okay.
and your current abilities.
Okay.
So it's about meeting you where you're at.
Right. It's not one size fits all at all.
Not at all.
Yeah.
And providing emotional support is also highlighted.
Oh, that's interesting.
Yeah, as a really important factor in how successful a physiotherapy program will be.
Okay.
It can be challenging at times, and having that encouragement and understanding from your therapist can make a huge difference.
I can imagine that.
And of course, any program should be based on practices that have been shown to be effective.
Right. Evidence-based?
Absolutely evidence-based.
Yeah.
And finally, I think it's important to understand that a well-designed physiotherapy program with specific goals in mind is generally a long-term commitment. And maintaining that consistency is essential to see those lasting benefits.
That's a good point, that long-term commitment. I think a lot of people need to hear that because, we kind of want that quick fix, don't we?
We do?
Like we just want to do something and then it's better.
Yeah.
But it's often that ongoing thing, isn't it?
It is. It's a journey.
Yeah. Let's talk about something that I know many people with MS deal with, and that's that feeling of stiffness and limited movement.
Yeah.
How do stretching and flexibility exercises fit into that?
So this is a really vital aspect. Your sources explain that in MS, increased muscle tone, often referred to as spasticity, coupled with periods of reduced activity can frequently lead to quite significant limitations in how freely your joints can move.
Okay.
So stretching and flexibility exercises play a crucial role in directly addressing these issues.
Okay.
The primary goals are to lengthen those muscles that have become shortened or tight, to lessen the impact of that increased muscle tone on your body, and ultimately to improve both your balance and your overall posture.
So it's not just about feeling more comfortable. It actually has a direct impact on stability and how you hold yourself.
Exactly. Yeah. And more broadly, incorporating regular stretching into your routine, whether it's before or after other physical activities, can increase your overall flexibility of your muscles, tendons, ligaments. And this increased flexibility can, in turn, reduce your risk of muscle strains and help prevent those painful muscle contractions and spasms that can be so disruptive in MS. Your sources recommend aiming for a stretching program that works both your lower and upper body muscle groups and trying to dedicate at least 10 to 15 minutes to it on a daily basis.
Okay, so not a huge amount of time.
Not a huge amount of time, no.
Are there specific techniques that someone with MS should keep in mind when they're doing those stretches?
Yeah, there are some really important recommendations.
Okay.
You should really focus on stretching those muscles where you tend to experience that increased tone or spasticity.
Okay.
The stretches themselves should be performed slowly, gently, and held for a sustained period. Avoid pushing yourself into painful positions.
Yeah, no pain, no gain does not apply here.
No, it really doesn't.
Okay.
Aim to move through a comfortable range of motion and then hold that stretched position for about 20 to 60 seconds.
Okay.
Bouncy quick movements, known as ballistic stretching, are generally not advised, as they can actually increase the risk of injury.
Right.
For individuals who have significant muscle tightness, passive stretches where a physiotherapist gently moves your limbs for you can be particularly beneficial.
Okay, so you don't even have to do the work.
Well, sometimes it can be helpful to have that assistance.
I see.
Your sources also mentioned that incorporating deep breathing exercises, light massage, and progressive muscle relaxation techniques during or after stretching can enhance the benefits. And it's worth noting that practices like yoga and Tai Chi, especially when guided by an instructor who understands the specific needs of someone with MS, can be very effective for improving flexibility.
Yeah, Tai Chi comes up a lot, actually.
It does. Yeah. It's a really valuable practice.
Okay, so that's stretching. We've got some real practical takeaways there. Now let's move on to balance.
Yeah.
Which is another common challenge for people with MS.
Absolutely.
What role do balance and coordination exercises play in a physiotherapy program?
So balance problems are very common in MS, and your materials point out that this can show up in a few different ways. Feeling unsteady when standing, experiencing slow movements, and generally having difficulty maintaining your balance, and this can increase the likelihood of falls.
Yeah, I can see how that would happen.
Yeah, but the good news is...
Okay, there's good news.
There is good news.
It's always good.
Research has really clearly demonstrated that specific balance exercises can be very effective in reducing the number of falls and the fear of falling, as well as improving your overall stability.
So less chance of falling, and if you do, you're better able to catch yourself.
Exactly. So it's really important to include activities in your exercise plan that are designed to challenge and improve your balance and coordination.
Okay, so like what kinds of things?
So these activities should work on your ability to shift your weight in your center of gravity. And to react effectively to those unexpected external movements or changes in your environment, things that happen all the time in daily life.
Right, so like if you trip on something.
Exactly, being able to catch yourself.
Or, if someone bumps into you or something.
Yeah, exactly, those everyday things.
Okay.
Your sources suggest incorporating exercises that use a therapy ball. And involve coordinated movements using both sides of your body. As these can be really beneficial for improving both balance and coordination. And as we mentioned earlier, in the context of flexibility, Tai Chi, with its slow, controlled, deliberate movements, can also be incredibly valuable.
There it is again.
I know, right? It comes up a lot. It's so beneficial
Okay.
for improving balance as well as strength and range of motion.
Oh, wow. It's like the wonder exercise.
It kind of is. And for individuals who might not have enough stability or strength to start with land-based balance exercises.
Okay.
Hydrotherapy, so exercising in shallow pools.
Okay. In the water.
Yeah, can be a fantastic starting point.
Okay.
The buoyancy of the water helps to minimize the risk of falls
Right.
and provide support, which allows you to attempt movements that might be too challenging on land.
I can imagine.
Potential benefits of water-based exercise include improvements in posture, flexibility coordination, and even muscle tone.
Wow. So it's good for pretty much everything.
Yeah, it really is.
Hydrotherapy sounds amazing, especially for someone who's really nervous about falling.
Absolutely. Yeah, it can be a really supportive environment.
Yeah. Okay, let's move on to aerobic exercise.
Mhm.
What are the benefits there?
So your sources are quite encouraging when it comes to the impact of low to moderate intensity aerobic training
Okay.
for individuals with mild to moderate MS,
Okay.
typically defined as having an EDSS score of less than 7,
Okay.
which indicates a relatively good level of mobility.
Yeah.
Studies have shown improvements in aerobic capacity, overall quality of life mood, and a reduction in feelings of depression.
Okay, so it's good for your mind and body.
Exactly. Yeah, it's
Yeah.
a whole package. And importantly, aerobic exercise is generally considered safe and well tolerated.
Okay, yeah.
For this group, and you might be surprised to hear this, but positive gains in cardiorespiratory fitness can be seen in as little as 4 weeks of regular activity.
So you could be feeling better quite quickly.
Yeah, that's right.
So what kind of things are we talking about? What's on the menu for aerobic exercise?
So the recommended aerobic exercises include things like walking on a treadmill,
Yeah.
cycling, either stationary bike or outdoors if appropriate,
Mm-hmm.
using arm or arm-leg ergometers, so those are like hand cycles or hand and foot cycles.
Okay.
Activities like rowing, jumping, and running might be suitable for individuals who maintain a higher level of physical function.
Okay, so a bit more advanced.
Yeah, and when it comes to how often you should aim for aerobic exercise, a frequency of 2 to 5 sessions per week is generally recommended,
Okay.
depending on how your body responds.
Right.
And it's often best to schedule these on days when you're not doing your resistance training.
Okay, separate them out.
Yeah, the duration of each session might start at around 10 to 40 minutes,
Okay.
again, depending on your level of disability.
Mm-hmm.
And the intensity should typically feel like a level of 8 to 15 on what's called the perceived exertion scale.
Okay.
So that means you should feel like you're working at a moderate pace where you could still hold a conversation,
Yeah.
but would notice your breathing and heart rate increasing.
Got it.
Progression over the first couple of months usually involves gradually increasing either the duration or the frequency of your sessions.
Okay.
After that initial period, you can then assess if you can comfortably tolerate exercising at a slightly higher intensity.
Okay, so starting slowly and building up.
Yeah, starting slowly and building up is key.
Sure. Okay, so lots of benefits to aerobic exercise. What about strengthening exercises?
Okay, so strengthening exercises, as your sources explain, involve making your muscles work against some form of resistance to make them stronger.
Okay, so weights and things like that.
Exactly.
Yeah.
Weights, resistance bands your own body weight.
Okay.
Depending on your current muscle strength programs, might include active assisted exercises where you might need a little help to complete the movement,
Okay.
active exercises where you can move independently,
Mm-hmm.
and resistance exercises using things like weights or resistance bands.
Yeah.
It's interesting to note that in MS, weakness in the lower limbs,
So legs and feet.
yeah, exactly,
Oh.
is often noticed earlier
Okay.
and can be more significant than weakness in your arms and hands.
I see.
When you're first starting out with strengthening exercises using weight machines,
Yeah.
can sometimes be preferred over free weights for safety and stability.
Right. So the machine kind of guides you a bit more.
Yeah, exactly. As your strength and confidence improve, you can then start incorporating exercises with free weights.
Okay.
If you don't have access to machines or they're not suitable exercises, using just your body weight, free weights like dumbbells and elastic resistance bands are also commonly used.
Yeah, there are lots of options, aren't there?
There are. And studies have shown quite clearly that resistance exercises can lead to improved movement capabilities, increased ability to perform daily activities, and a reduction in both fatigue and overall disability for people with MS.
Wow. So really beneficial.
They're generally considered a safe and well-tolerated form of exercise.
That's great to know that it's not just about getting your heart rate up, but it's about building that strength as well.
Yeah, it's both.
What are some guidelines for incorporating strengthening exercises?
Generally, it's recommended to aim for 2 to 3 strengthening sessions each week,
Okay.
with each session including somewhere between 1 to 3 sets of 8 to 15 repetitions for each exercise.
Okay.
The focus should be on working those large muscle groups in your body.
Like legs, back, chest.
Exactly. Legs, back, chest, shoulders,
Mm.
as well as targeting those specific muscles that, are feeling weak or are making certain movements difficult.
Mm-hmm.
Interestingly, some research has shown that balance training that includes wearing weights around your torso,
Oh, like a weighted vest?
like a weighted vest, yeah,
Okay.
and balance exercises that use virtual reality can actually have positive effects on improving your walking pattern.
Oh.
So again, that technology can really play a role.
Yeah.
And as with many types of exercise, it's really important to start gradually,
Mm-hmm.
beginning with exercises that feel relatively easy and then progressively moving to more challenging ones as you get stronger,
Okay.
especially when you're working on balance in your walking pattern.
So don't go too hard too soon.
No, definitely not.
Okay. What other recommendations do we have?
Okay, so your sources provide some specific recommendations,
Okay.
such as making sure you have a rest period of about 2 to 4 minutes between sets of exercises,
Okay.
adjusting your program based on how fatigued you're feeling
Yeah.
on a particular day.
Right. Listen to your body.
Absolutely prioritize exercises for those larger muscle groups before you work on smaller ones,
Okay.
and paying particular attention to your lower limb exercises.
Legs again?
Exactly, because weakness in your legs is so common in MS.
Okay.
It's also a good idea to focus on the muscles that surround your major joints.
So like shoulders, hips.
Yeah, shoulders, hips, knees, ankles.
Okay.
Strengthening those can provide better support and stability
Yeah.
for safety, especially if you have any issues with your sense of joint position or your balance. It's often safer to perform weightlifting exercises while seated
Okay.
to minimize the risk of falling.
Okay.
So again, safety first.
Yeah. And supervised exercise with a physiotherapist is always recommended
Mm-hmm.
in these situations to ensure you're using proper form and staying safe.
Yeah, getting that expert guidance.
Yeah.
Okay, that all makes a lot of sense.
Mhm.
The materials also touched on the link between steroid use and bone health in MS.
Yes.
How does exercise fit into that? So your sources point out that the use of steroid medications, which are sometimes part of MS management,
Yeah.
along with reduced physical activity, can unfortunately contribute to a higher risk of osteoporosis and even fractures.
Okay.
In individuals with MS,
Yeah.
reduced activity can also lead to a general loss of both muscle and bone mass.
So it's kind of a double whammy then.
Yeah, it can be.
Okay.
So weight-bearing exercises in particular are highlighted as being really important for
Mhm.
helping to slow down this process and maintain both your muscle and bone density.
So getting those bones strong.
Exactly. So a resistance training program that works all the major muscle groups is generally recommended.
Okay.
It's also worth remembering that while both aerobic and resistance exercise can potentially cause a temporary increase in body temperature,
Yeah.
resistance exercises tend to lead to fewer reports of symptom flare-ups
Okay.
in people who are sensitive to heat. And a really important takeaway is that for both your safety and to ensure you're getting the most benefit, it's highly recommended that resistance exercise is performed under the guidance and supervision of a physiotherapist.
Okay. So again, that expert guidance.
Yeah, supervised training has actually been shown to be more effective than trying to do it on your own.
That's good to know. That makes a lot of sense. Now, let's touch on something that might not be on everyone's radar immediately. Respiratory muscle training.
Yeah.
Why might that be relevant?
Your material suggests that in some individuals with MS, a feeling of decreased exercise tolerance might be linked to a reduction in the strength of their respiratory muscles.
The muscles you use for breathing.
Exactly the muscles you use for breathing. Okay, so respiratory muscle training involves specific exercises designed to help strengthen these muscles.
Okay.
The idea is that by improving the strength and endurance of your breathing muscles, you can potentially increase the maximum amount of air you can inhale and exhale.
Right. Get more oxygen in.
Yeah, exactly. Which in turn could have a positive impact on your overall ability to exercise and your general well-being.
Interesting. It's another aspect of physical fitness to think about.
Yeah, it is.
Now, the sources also mentioned telerehabilitation.
Mm-hmm.
This sounds like it could be a game changer for accessibility.
It really is. Yeah,
Can you tell us a bit more about that?
absolutely. So telerehabilitation is becoming an increasingly valuable tool.
Yeah.
Your sources define it as the delivery of rehabilitation services remotely
Okay.
using various types of telecommunication technology.
Yeah, like phone calls and video calls and stuff.
Yeah, exactly. Things like phone calls, video conferencing through platforms like Zoom webcams, internet-based software or apps.
Okay.
So this allows for remote assessments
Right?
and the delivery of therapy without you needing to travel to a clinic.
So you could be anywhere in the world.
It could be anywhere.
That's amazing.
And this offers some significant advantages, including not having to worry about transportation,
Yeah, that's a big one.
potentially lower costs,
Okay.
and greater access to rehabilitation services, especially for individuals who might have difficulty getting to in-person appointments
Yeah.
due to mobility issues
Right.
or geographical limitations.
Right, if you're in a rural area or something.
Exactly. And recent evidence suggests that telerehabilitation can be a safe and effective option for people with MS,
Okay.
home exercise programs that are delivered and supervised remotely by a physiotherapist.
Okay, so you're still getting that guidance.
Yeah, you're still connected.
Okay.
Can be effective in improving things like your walking pattern,
Mm-hmm.
balance brightens,
Yeah.
cognitive functions, levels of fatigue, feelings of anxiety and depression, and your overall quality of life.
Wow. So it can help with a lot of things.
Yeah, it really is a holistic approach.
That's amazing.
So it really presents a viable alternative to traditional in-clinic sessions
Yeah.
when it's structured thoughtfully.
That sounds like a really promising way to make physiotherapy more accessible to more people.
I think it has huge potential.
Yeah. Let's talk about some of the challenges that people with MS often face when it comes to exercise. And the materials highlighted fatigue, heat and intolerance, and the risk of falls.
Yeah.
Let's start with fatigue, because I know that's a major issue for a lot of people.
Fatigue is a very common and often one of the most debilitating symptoms
Yeah.
for individuals with MS, affecting a very high percentage of people.
Yeah.
It's frequently linked to other challenges like depression, pain, anxiety, and even cognitive difficulties.
Yeah.
One of the understandable concerns for people with MS is whether engaging in exercise might actually make their fatigue worse.
Yeah, I can see that that would be a worry.
Yeah, and we also know that increased fatigue as the day goes on, particularly in the afternoon,
Yeah.
can negatively impact things like walking performance and overall physical capacity.
Okay.
However, and this is important to emphasize, the research actually suggests that regular exercise training can lead to a moderate and in some cases even a significant reduction in fatigue.
Really? So it can actually help?
Yeah, it can actually help.
So pushing through that initial barrier can actually lead to less fatigue in the long run.
That's right.
Okay, that's good to know, because I think a lot of people hear that and think, oh no, exercise is just going to wipe me out.
Yeah, I think it's understandable, but it's about finding that right balance
Yeah.
and gradually increasing activity levels.
So what kind of exercise are we talking about here?
So regular aerobic exercise in particular is recommended
Yeah.
as a strategy for reducing fatigue, improving your overall sense of well-being, and enhancing your quality of life.
Okay.
Studies have also shown that exercise programs that combine both aerobic and resistance training,
Okay.
as well as using elliptical trainers and participating in water-based exercises, can be effective in reducing fatigue in individuals with MS.
So lots of options there.
Yeah.
Okay, what about heat intolerance? That's another big one.
Yeah, heat intolerance and a specific phenomenon called the OTHOF phenomenon.
Say that 5 times fast.
I know, right?
The OFF phenomenon.
Yeah, where a temporary worsening of existing symptoms like blurred vision
Okay.
can occur due to even a slight increase in body temperature from exercise.
Okay.
Is definitely something to be aware of.
So exercising can make your symptoms temporarily worse?
Yeah, it can in some cases,
Uh-huh.
but it's crucial to understand that experiencing the OTHOF phenomenon during exercise is not a reason to avoid exercise altogether.
Okay.
The symptoms are temporary and don't cause any lasting damage.
Okay, that's reassuring.
Yeah, and your sources offer some really helpful practical tips
Okay, good. Let's hear them.
for managing heat intolerance during exercise.
Okay.
So using cooling strategies like having a fan blowing on you exercising in an air-conditioned environment,
Yeah.
or even using wearable cooling devices during your workout can be beneficial.
Oh, wow. Like those vests that athletes wear.
Yeah, exactly like that.
Okay.
Applying ice packs to your body after exercising can also help to reduce fatigue and improve mobility.
Interesting. So you don't even have to do it during.
No, you can do it after. Interestingly, taking a warm bath or shower for about 20 to 30 minutes before and after exercising
Before and after.
is also sometimes suggested.
Oh, wow. I would thought you'd want to cool down.
Yeah, it seems counterintuitive,
Yeah.
but it can help to regulate your body temperature.
Interesting.
Wearing light breathable clothing or even special cooling vests designed for athletes can make a significant difference
Yeah.
if you're considering.
So really being mindful of your environment, clothing, and the timing of your exercise can make a real difference. Speaking of timing, does when you choose to exercise matter?
Timing is definitely key. It's best to avoid exercising during the hottest parts of the day or when you tend to feel most fatigued. Many people find that early morning sessions are a better option because it's usually cooler then, and your body temperature is naturally lower.
That makes sense. So the bottom line is that structured exercise programs are really valuable for people with MS, but it's crucial to listen to your body and avoid pushing yourself to the point of overheating. Okay, let's shift gears now and talk about falls. We've seen some statistics that highlight just how significant an issue this can be. What were some of the key takeaways from the research?
Yeah, the stats are a bit concerning. Over half of people with MS, 56% to be precise, report having at least one fall in a 3-month period.
Wow, that's more than half.
Yeah, it's pretty common.
So what are some of the main risk factors that came up in the research?
A few things consistently popped up. Difficulty with balance, obviously. Then there's decreased strength in the lower limbs, increased spasticity, those stiff muscles and involuntary spasms and fatigue. Even things like urinary incontinence can contribute.
It seems like a lot of different things can play a role.
It's complex, for sure. And it's interesting. The use of mobility aids is actually the most commonly reported factor associated with falls.
I wouldn't have expected that. You'd think those aids would help prevent falls.
You would, but it highlights the importance of proper fitting and training with those aids, and maybe even reassessing whether you need a different type of aid as your needs change.
Good point. So what about incorporating exercise to help reduce fall risk? What does the research suggest?
Well, balance and coordination exercises are key. They can really help improve overall function and directly reduce the likelihood of falls. And encouraging people to actively participate in those exercises, to be really engaged in the movement, that's huge. It contributes to maintaining independence in everyday life.
So it's not just about preventing falls in a reactive way. It's also about proactively building strength and stability. Are there any specific recommendations for fall prevention from the sources we have?
Definitely. Physiotherapy and rehab programs that specifically target balance and strength are super important. And it can be as simple as wearing orthopedic shoes with good arch support.
Yeah, footwear is often overlooked.
It is. And non-slip shoes are a must, both indoors and outdoors. You should also take a good look around your home and identify any tripping hazards.
Like loose rugs or clutter.
Exactly. And in high-risk areas like the bathroom, handrails can be a game changer. These are all practical, actionable steps you can take right now to make your home safer.
Now let's talk about spasticity and loss of strength. These can be huge challenges as well. How would you define spasticity for someone who might not be familiar with the term?
Spasticity is basically an increase in muscle stiffness. It can make it difficult to move your limbs voluntarily, and your movements might be slower than usual. Prosperini and colleagues back in 2016 described how spasticity can restrict the range of motion in your joints, mess with your joint positioning, and even disrupt your normal movement patterns.
So it's not just about stiff muscles. It can have a real ripple effect on how your whole body moves.
It can. And it can lead to restricted movement and even some pretty painful muscle spasms.
That sounds really challenging to deal with. What do the sources suggest for managing spasticity and loss of strength?
The key is to take a multifaceted approach. Effective pain management is essential, for one. You also want to prevent secondary complications like pressure sores and deep vein thrombosis.
So taking care of your overall health is really important in managing these issues.
Absolutely. Even simple things like avoiding tight socks and clothing can make a difference. And then there are specific exercises that can help: stretching, active range of motion exercises.
What about using ice?
Ice packs or ice massage can be really helpful for relieving spasticity. And there are some other potential therapies like functional electrical stimulation and biofeedback. And of course, if needed, assistive devices can be really helpful for improving mobility.
So it sounds like there's no one-size-fits-all approach. It's really about finding what works best for each individual.
Exactly. Your exercise program should be tailored to your specific needs and challenges. And it should also be adapted as your condition changes over time.
That makes perfect sense.
The research, especially from Heine and his team in 2020, strongly recommends that people with MS get involved in personalized physiotherapy programs as early as possible. Early intervention can make a huge difference.
Now let's touch on some general safety measures that everyone should be aware of when exercising.
Yeah, some really important things to keep in mind. If you've been inactive for a while and are feeling a bit weak, You absolutely need to start gradually and slowly increase the duration and intensity of your workouts as you get stronger.
So no jumping right into a high-intensity routine.
Not a good idea. And it's also important not to push yourself to the point of excessive sweating or where your movement becomes restricted. Dress comfortably in clothing that's appropriate for the weather and what you're doing. And don't forget to breathe.
Breathing. People forget to breathe when exercising.
Sometimes, especially if they're pushing themselves really hard, make sure you're breathing continuously and comfortably throughout your workout. No holding your breath.
Got it. Breathing is good. And staying hydrated is crucial too, right?
Oh yeah, absolutely crucial. Exercise increases your body's need for water, so make sure you're drinking enough, especially when it's hot out.
Good reminder. And are there any specific warning signs that people should be aware of? Things that should prompt them to stop exercising and talk to a doctor?
Absolutely. If you experience any chest pain, palpitations, or an irregular heartbeat, you should stop immediately and seek medical attention. Same thing if you experience shortness of breath, dizziness, or any darkening of your vision. Nausea and vomiting are also red flags, as is any significant unexplained weight loss.
So these are serious signs that shouldn't be ignored.
Right.